we had about 6 to 7 years of annual recurrent funding, which was very hard to plan long term, and we really welcome the $360 million over 4 years funding agreement with Queensland so we can provide kindergarten services for up to 250,000 children in this state. We know that Kindy provides them a great start, and we're really looking forward to rolling that out with the Commonwealth over the next 4 years, and very happy for the secure funding. Today's COVID numbers, I'm here with Dr. John Gerard. They are quite high. We have 2,222. Can I repeat? 2,222 new cases today. These are being detected obviously in about 30 local government areas, and that makes it 8,586 active cases. The good news is though that there are 0 numbers at the moment in intensive care units. So we have 0 numbers in ICU, and Dr. John Gerard will go through the numbers in hospitals and give you more details on that. Tests by Queensland Health yesterday were 35,179. Vaccinations, the first dose is now 90.16%, and fully vaccinated 86.19%, and that is good news, but we obviously need to have more vaccination rates than what we currently have at the moment. We would like to definitely see that mid-90s of being fully vaccinated, but obviously a gentle reminder that if you haven't had your first dose, please get yourself vaccinated. Omicron does not discriminate. It is highly contagious, and we now urge you more than ever, as it finds its way throughout Queensland with the case numbers as well, for you to get fully vaccinated. If you've had your first dose, please ensure that when your second dose is time for you to get that, to please have your second dose in a timely manner. That way we can soon get to our 90% fully vaccinated. And of course, if you're due for a booster, I've already booked mine in for early January when I'm due to have my booster shot. And if you are due for a booster, please get that on time as well. The second thing is the mask wearing. Please, if you're indoors, we're outside today, wear your masks. They are an additional protection against contracting COVID, and it is very important that obviously if you choose to wear one outside, as many do. I went for a walk with Michael yesterday, and we saw many people working, and we had ours with us when you're on a walk, if you can wear one. And the third issue, of course, is to ensure that you do check in. It is important, if we do need to get in contact with you, that you do continue to check in and obviously show your green tick being fully vaccinated. Dr. John Gerard has more information in relation to COVID today, and I'll transfer now to Dr. John Gerard.
Thank you very much, Minister. So today in Queensland we have 2,222 new cases to report. This brings the total seen in Queensland since the beginning of the pandemic to 10,752. We currently have 8,586 cases active that have been we've seen over the last 2 weeks since opening the borders to the other states of Australia. Trying to relay this message in a balanced manner is actually quite difficult, and it's something that we've all been grappling with in my professional world. If I can just take you back and compare what's happening now with 2020. So to the end of June 2020 in Australia, there were 8,566 COVID cases diagnosed. So about the same number as we've seen in Queensland since the borders opened just over 2 weeks ago. But associated with that 8,566 cases last year were 204 intensive care admissions and 30 deaths. Now in Queensland so far, we have since this latest wave, since opening the borders, we have seen no intensive care admissions, and there have been no deaths reported. Now, I'm talking to my colleagues in hospitals on a regular basis, and I can say it is likely in the coming days that there will be intensive care admissions. So there definitely are sick patients in hospital. The really big issue, though, and this is the key issue in trying to balance this message, is we're not going to be talking about 8,000 cases in a few weeks. We're going to be talking about tens of thousands of cases. And that's what a pandemic is about, very large numbers of cases. But the good thing is the vaccines are working, and they have been clearly demonstrated to work. And for those people who have not yet received their third dose, particularly the elderly and those who have impaired immunity, it is critical, if you can, to go out and get that third dose of vaccine in the next few weeks, when your time has come. So at the moment it's 5 months after your second dose, but from the 3rd of January it will reduce to 4 months. So in terms of testing, there were 35,179 COVID tests conducted yesterday. Queues have improved a bit, but demand remains high, and I think we are now targeting better the patients, the people that we want to see, those who are more likely to have infections. We have over 1,809 cases receiving care in their homes. There are 103 cases in hospital at the moment, but as I've mentioned previously, it's difficult sometimes to work out what proportion of those are there in hospital because of treatment for actual COVID or symptoms of COVID or other reasons. There are at least 29 receiving treatment for COVID in Queensland hospitals at the moment. In terms of vaccinations, the state clinics started to reopen yesterday, and 11,700 doses of vaccine were given. More than half were boosters, and around 1,000 were first doses. So as of the 27th of January, our vaccine coverage is 90.52% of the 16 plus population having at least one dose, and 86.19% of the 16 plus population having two doses. Now, as expected, the number of cases of COVID is increasing significantly, and it will continue to increase significantly in the coming weeks. Most people, particularly those of us who have been vaccinated, who have received at least 2 doses of the vaccine, will be relatively well. The illness will be mild in the vast majority of you, and that means you can care for yourself at home. We continue to receive reports of people, as soon as they receive the message that they have COVID-19, calling 000 and calling an ambulance to bring them to the emergency department, or presenting straight up to the emergency department, even if they have just mild symptoms. I must emphasize, the majority of us will have mild symptoms if and when we get this infection, because in the next few weeks, all of us will know somebody who has it, and there's a good chance that we may well ourselves get it, and if we've been vaccinated, that illness will be mild. But even if you're vaccinated, there is a significant chance that you will acquire this infection in the coming weeks. So for everyone who has mild symptoms, I want to share with you the first 5 things you should do when you test positive. 1, isolate and tell the people you live with to get tested and quarantined. 2, answer the survey questions a health worker calls or texts you about. 3, tell people you have been in contact with recently to get tested and quarantined. 4, ensure that you have supplies of food and medications and get contactless delivery if you need it. And 5, look after yourself, keep a symptom diary and look after your mental well-being. Thank you very much.
The check-in app, is that automatically notifying Queenslanders that have been to a venue that later become an exposure site? And if not, why should people bother checking in if they're not being contacted by Queensland Health?
It is notifying them, and it is important that people continue to use the check-in app. All of these issues pertaining to contact tracing are currently under review after some recommendation made by the AHPPC last night, of which I am a member, and that has gone to the National Cabinet. So all of this is currently under discussion. But the check-in app is still important at the moment. Whether there are changes to the way we use it, this will come out in the next few days. But at the moment, please continue to use the check-in app as advised. There are a lot of people relatively well presenting to all the emergency departments in Queensland when they get that message, and that's why it's critical that we get this message out that the vast majority of people with COVID-19 will have an illness not dissimilar to one they would have had many times before, and they should wait to be contacted unless of course they have significant symptoms like breathlessness or chest pain.
Are they rocking up? Are they frightened? Are they scared?
I think they are, and this is why it's very important that I get this message balanced. The problem that we're going to be encountering in the coming weeks is that of very large numbers of people. So even if only a tiny proportion of a very large number needs to go to hospital or get sick, that's still a large number. But the vast majority of people will get a mild illness. In fact, before I did this job and I was practicing in this area, the majority of people whom I told had COVID-19 said, no, the test must be wrong. This is not COVID-19. This is not, because the mild illness is not what most people are expecting. Most people are expecting to have some dire illness. That does happen to a small proportion of people, particularly the older, particularly those with underlying medical conditions, and occasionally younger people vaccinated can get significantly unwell. It does happen.
When you say tens of thousands of cases, are you talking about in Queensland alone?
Oh, certainly. Certainly tens of thousands. Many
You
cases.
previously said that communities that hadn't reached 80% double dose vaccination rate would remain subject to lockdowns. Given we now have spread in remote Indigenous communities where their vaccination rates aren't at 80%, do you think they should be locked down?
It's not our intent. We will work with the local communities, but it is not our intention to impose lockdowns on communities.
Are we over lockdowns now?
It is not our intention to reimpose lockdowns. We will work with local communities as required, but it is not our intention to impose lockdowns.
How many of these cases are in remote communities?
I'm aware of there are 11 cases in Thursday Island and 1 case at Cherbourg overnight. That's a new location, Cherbourg overnight.
Why not consider lockdowns given those low vaccination rates and the vulnerabilities there?
Again, it will depend on what the local community wants to do, but we do not want to impose lockdowns on communities. It's not something that we feel is the right thing for us as a government to be doing. But we'll certainly liaise with the local communities to determine what it is that they would like to do, but we do not want to impose that on local communities.
The surge in cases here and across the border in New South Wales, is there a case to be argued for putting the brakes on?
No, I think we need to keep moving on. We need to move on. We are not going to stop the Omicron virus. There are some things we could do to slow it a little bit. Obviously, masks are critical. I think we'll increasingly message people that in January, when the cases are at a very high rate, if you can work from home, I think that will be a good thing to start thinking about at the moment. So those are the sorts of things that we need to talk about, but not lockdowns.
Are you all concerned about the Prime Minister's call to change the definition of a close contact?
What I believe the Prime Minister is referring to is a document that the AHPPC has referred to National Cabinet for consideration today.
The President and a number of other public health officials have sort of said this could create a silent scourge of the pandemic if you redefine that definition of close contact. What do you say to that? When potentially people who have it not be informed that they
Okay. The numbers of patients that we are expecting to acquire this infection. Well, I'll wait for the plane. The number of people we expect to get infected with this virus is very large, very large. All of us will know somebody who is infected. If we continue using our current settings, then soon all of us will be in quarantine and the state won't function. That is why the settings I believe should change. But this is something that is being considered by National Cabinet today, and the details I'm not at liberty to discuss. It depends on what the National Cabinet comes through with. But it's very clear that if we continue with our current settings, the country won't function. And remembering that most people don't get critically ill. It's a small proportion.
Based on the current trends in cases, do you still expect cases will peak in months' time, or could it be much faster than that?
I think we haven't seen the full modelling, but given the degree of contagiousness of this virus, I suspect that the peak will now be earlier than it was originally projected in the Doherty modelling. Originally the Doherty modelling, which was based on the Delta virus, predicted there would be a delay of 2 or 3 months after the introduction of the virus into Queensland. But this virus is considerably more contagious than the Delta strain, so the peak is likely to be earlier. But the good news is it definitely seems to be milder. So it's still not trivial, but a little bit milder. I'm talking with the doctors in the hospitals looking after these patients on a day-by-day basis, and we're beginning to believe we can discriminate those with Omicron and from those with Delta. Although, speaking with my colleague in New South Wales, my colleagues in New South Wales, they are seeing Omicron cases in the intensive care units there. So I'm not saying you cannot end up in intensive care with Omicron. You can.
What's the supply of rapid antigen tests like in the retail sector and the government's own, the state government supply?
What I can tell you is that we have an adequate supply for use in the clinical sector. So we have started to use rapid testing in emergency departments, for which we have a supply. We have also have on order another, I believe, 7 million tests for Queensland Health. I can't tell you about the retail situation.
Is there any prospect of those being made free to Queenslanders at some point?
This is something under discussion at this stage. I don't know about this at this stage.
Dr. Gerard, could I just ask you what your reaction was? Today it was revealed that some people are taking matters into their own hands, if you like, creating their own contact tracing system on Facebook. Are you concerned about that?
I'm not concerned about it. If people want to avoid getting infected, that's fine. It's not a concern. What we're saying is that if we attempt to isolate every casual contact of everyone with COVID-19 in Queensland, then everyone will be in quarantine, and that's not necessary.
What's the contingency plan then for schools? If you want people to work from home, what's your advice to parents, I guess, in the lead up before schools opening? How will they be able to function given you're going to have tens of thousands of cases?
What I would say is that if we're going to experience a pandemic, because this is the first time Queenslanders will really experience the true pandemic. If we are going to experience this pandemic, then January is probably the best time to be experiencing it, because it's warm and we know that the virus spreads more easily in the cooler months, and the schools are on leave at present, so they're on holidays at the moment. So if and now, this is the time to be having a pandemic. We've got all of Queenslanders have had the opportunity to get vaccinated. It's warm, the schools are on holidays. This is the time to have it, but it will be something that we have not experienced before.
In the UK, teachers were given rapid antigen tests to take before they went to school, just to prevent mass closures and teachers being put into quarantine. Is that something you're considering?
Well, obviously rapid antigen tests, the availability and the usage is being discussed not only at National Cabinet today, but I'm sure we'll move quickly, that if that is then accepted, that may be something that we will do in schools. We are preparing schools on a number of scenarios about what happens when we go back after the holidays. As Dr. Gerard just said, we're fortunate at the moment that we are on school holidays. We know what happened down south in New South Wales and Victoria and the ACT, and we will move quickly under the health advice and prepare up-to-date scenario information to schools. But rapid antigen tests or RAT tests are very much on the agenda, and I believe they're on the agenda for discussion at National Cabinet today.
So ahead of the school year, would you consider mass vaccination clinics specifically for children, since they haven't had the opportunity to get vaccinated?
Yes, we had a meeting this morning with the Premier and senior ministers and Dr. Gerard, and of course everything will be on the table. We think it is important that children have access to vaccination as well, and we will certainly be putting some, cases where there are hubs, etc., so that parents who want to get their children vaccinated, and we urge them to do so, obviously will be able to have access to those hubs.
December 17 was the cut-off for the first jab for teachers. Do you have a rough idea of how many we don't know their vaccination status?
Yeah, look, it's been actually very good. I haven't got the up-to-date figures yet, but what came in at that time was very high. Of those who had responded, about 98% already had been double vaccinated. So we're very pleased with those figures. We hope that they will continue, but remember the deadline date is the 23rd of January, and it is a mandate, and we're urging all staff in childcare centres, detention centres, in correction centres, and of course staff in schools to be vaccinated right across the government and non-government sectors. And I believe some universities now have made decisions that they will only accept fully vaccinated on their campuses.
Minister, just quickly, the opposition has raised some crime statistics showing that crimes like assaults, robberies, sexual offences, they're all going up in the southeast. Is crime getting worse in the southeast?
Look, that's probably a issue to raise with the police minister. Unfortunately, I don't have those statistics with me, but if there's ever anyone who would raise a doom and gloom and the sky falling in, it would be the opposition.
Are you expecting a teacher shortage in rural and regional areas, given that's already a problem that we don't have enough teachers out there, plus the vaccine mandate, plus the spread of Omicron? What's going to be done?
At this stage, we can adequately provide. Remember, at the height of COVID in 2020, we had many teachers who were in that vulnerable category away. We had teachers that were ill that needed to stay away, and we were adequately able to cover for all of them. With the double vaccination and the high number of teachers that are reporting that they are double vaccinated, we can easily accommodate them.
Wales government's offered to pay for travel and accommodation for people to go out to rural and regional areas. Is that something the Queensland government?
Oh, look, our agreements cover a number of arrangements for teachers to go out to regional or remote, and if we need them, obviously we will do all we can so that they're not out of pocket.
Any thought being given to mask mandates at schools when you return, or delaying the calendar altogether because of the...
At this stage, we will always take the health advice on mask mandates in schools, but obviously if those want to voluntarily use them in schools, they are more than welcome to do so, and we will take the health advice closer to the school opening term.
The school calendar, is that on track to return?
Yes. At this stage, we really have no changes to the school calendar, and we're making sure that, of course, we've got all the scenarios in place to cover whatever situation arises.
One more for Dr. Brown.
Last question for me, if anyone has one. Thank you.
Just with the move towards close contacts being household contacts rather than people mingling, will that be the same, do you see, in schools, given that so many children are unvaccinated, or do you think that teachers, that might be different definition of close contacts in schools?
Well, all of this is before the AHPC is putting their recommendations to National Cabinet today, and I prefer not to comment further on what comes out of that. I think it would be better if I didn't.
Thanks all.
Thank you.